For best results, ePRISM can be reviewed before the patient arrives in the cath lab. This allows for time to ensure the patient is hydrated to reduce the risk of kidney injury. It also allows the staff the time to plan for the appropriate procedural approach and medications to reduce the risk of bleeding. Patients can also be scheduled, and resources can be secured according to individual risk factors to improve throughput. ePRISM seamlessly integrates with your medical record, and therefore no additional logins are needed. Press the ePRISM button and the proper screen will open based on the patient's care pathway. The patient care pathway starts at diagnosis. The first ePRISM screen that will open is the survey screen. The patient's demographics, height, and weight will auto-populate from the medical record. If resulted within the last 30 days, labs will also auto-populate. If you would like to hide the completed questions, click on the Hide Completed button on the top right of the screen. This will display only the questions that require an answer. Answer the questions for the patient's history as you move down the screen. If you need clarification on a specific area, click on the question mark next to the word, and a description will populate. If the survey is not complete, press Save and the progress will be saved and can be accessed at a later time. On the day of the procedure, verify the last clinical documentation section and update as necessary. All sections must be completed in order to run the risk profile. Once submitted, the patient's individualized risk profile is generated onto the display screen. You will notice on the left side of the display screen the patient's information is populated, including height, weight, BMI, and lab work. In the center of this screen are the patient's individual risk profiles, including AKI risk, bleeding risk, and mortality risk. We recommend reviewing this information as far in advance of the procedure as possible so that you can activate evidence-based protocols and schedule the patient and resources accordingly. This improves outcomes and throughput by improving patient and resource readiness. Once the patient is in the cath lab, the team can open and use this screen as their timeout board. On the right-hand side of the screen, you will find the patient's individualized contrast dose. We can also place your facility's best practice recommendations here. Upon completion of the procedure, complete the data capture portion of the page. This section will populate into an electronic handoff screen and is customizable to suit the needs of your program. The electronic handoff screen can be utilized by any post-procedure staff that will be taking care of the patient. It is a quick glance of the patient's risk factors and handoff report. This report can also include predicted discharge information generated by ePRISM to improve discharge efficiencies. Thank you.